Hi, everybody. Today we're going to take a quick look at a client that we have and how we ended up helping turn their practice around in just a few revenue cycles. So, about this business, so they have 100% of their revenue, well, let's say about 90% of their revenue coming from overhead splits with OHIP revenues, so Medicare revenues in Ontario. They've been in practice for about 10 years, actually much more than 10 years. They had the same leadership. So, owners had changed a few times, but the practice leadership, the people who were running the administration, had stayed through those culture transitions. It was acquired by a strategic for a very healthy multiple. The old owners walked out, the new owners walked in with the legacy staff. They had thought things were going to go well. But unfortunately, what they ended up getting were some massive operational challenges. Revenue wasn't transparent, reporting was not hugely accurate, didn't include third party revenues or private cash revenues. Cash flow was very lumpy and challenging. And obviously, if the business wasn't profitable, going from paycheck to paycheck was a bit of a challenge. And as a result of all of that, culture. The business was ultimately facing a shutdown because no one was sure how to be able to show the physicians that the new leadership and the new ownership were going to be able to be and run things a little bit better than the last group did. So we were brought in to help. What did we bring in and how did we look at it? Well, basically, what we did was we looked at the tool belt first. We decided communication to stakeholders is the most important place to start. And the leaders of the organization, the new acquirers, and the people that were rolling up their sleeves to work needed to be the ones to make those communications. So we started sharing with the physicians a little bit about us, how we improve revenues, reporting, and how they'd be able to see more money with more transparency faster. We communicated the same to the acquiring company's bank and to all of the other partners and stakeholders across that organization. We then immediately put in our Clarity Concierge dashboard and started setting KPI benchmarks that were focused around their change. Now, in every clinic and in every practice, what matters generally is the same, but what matters specifically changes. And so for every client, we end up looking at very, very clear specifics. And for this particular group, we did that as well. The KPIs that we ended up picking were very helpful, what we call leading indicators, to be able to show us that physicians were feeling and working more comfortably and more proactively. Because if the doctors were happy, we knew that they'd end up seeing more patients more efficiently, more effectively, ultimately make more money for themselves, and by extension, do better for the practice. The claims concierge came in and completely improved the revenue cycle. So when our claims concierge team came in, that combined with our tech that looks at all of the different errors and opportunities that had been missed, we were able to improve revenue for each physician by about 20% in 1 month with no changes to any physician behavior. If anything, they actually saved time because we were able to do more for them. We ended up being able to automate reconciliations and give them clear statements and give the client, the company that bought, clear statements in increased trust in pretty much real time. Payment, communication, culture, and referrals. All of that started to come a little bit more closely as our automated statements and payments started going to the doctors and to the finance department, getting both groups paid in days and offering marketing support through some introductions that our concierge team had made, and coaching resources to help ensure that they had the support they needed while revenue was increasing and while there were some changes going on in the organization, to arm the leadership and give them the comfort that they needed to know that things were literally and figuratively getting better. How do we prioritize our turnaround and our growth? Well, for this particular group, and for most groups, communication is a critical thing. So we asked them to really focus on their values and thanking the physicians and thanking the team, the senior team that they wanted to keep, through the transformation and through the turnaround, thanking them for their trust and telling them what was going on. What does that mean? It means we were telling them literally what we were going to do and how we were going to do it. We used Clarity Concierge to show how we were going to measure our success and the examples of that success. And we created a culture of accountability. With everyone seeing the same dashboards, the same graphs, the same numbers, the same outcomes, there was no passing the buck. There was no finger pointing. Everyone has to be very clear and very transparent. And if there's a problem or an issue, we don't let it fester. And we call it out right away. And we do it in a safe, respectful manner so everyone feels comfortable sharing how they feel and why. The next immediate thing we did, and this was almost in real time, was clean up the claims. We cleaned up the prior 3 months, the day that we started, and we're given the green lights to get going. We started optimizing the claims on a go forward basis, and we offered billing tips to each physician as we introduced ourselves. And that was a big part of how we started to gain trust. We had individual sessions with the physicians. We explained to them what we did, how we did it, who we were, our track record in the space. And we showed them examples of what they were going to be able to see as a result of changing just a couple of habits for the more efficient or for the better. And the result of all of that improved a ton of accountability and improved trust. And of course, the payment automation in place, all of a sudden within 2 cycles, the physicians and the practice could see that reconciliations were done very quickly. Everyone knew exactly how much money was coming in, exactly where it was going, and it was all delivered exactly when it should be. And that has a huge amount of credibility that comes with it, especially over 1 or 2 cycles. And so, what does that all mean? Well, transparency, clear financial statements, huddles on progress, and of course, with the huddles on progress, a sync on the physician communication, making sure the physicians are communicated with regularly and respectfully, making sure they have absolute access to everything they want to see. And, on our end, on the physician's first end, offering resources to support the internal efforts of that team as they started making these, very important cultural moves to turn around their practice and get back to growth. This is a quick look at a couple of the dashboards that we showed them and how we got going. And so month over month, this practice was believing that they were going to be earning more than they were because they had thought that every encounter ended up needing the same amount of revenue. When we looked at the different encounters by encounter type, we realized that some made more money than others, and the volume of specific types of appointments greatly outweighed those of other appointments. And so when we looked at it like this, the management were able to see exactly how the revenue was being generated and exactly that all appointments weren't equal. And so as the practice was able to start growing and we were able to start changing those behaviors and habits, we were able to really focus on the most effective types of care, both for patients and make sure that we were prioritizing patients that also were able to generate the margins that the practice needed to be able to continue to help the community. This is another really important one. And this one is great, not just for the clinic as a whole, but for the doctors as individuals. When we showed them their error reports here, what we could see is that there was $30,000 left on the table. That $30,000 was really, really important because, of course, not only is it cash, but it also showed that the claims errors of the past were administrative in nature and could actually be easily fixed. So we got that cleaned up, and we were very pleased to report that within 2 revenue cycles, this group ended up having 0 errors. So what were the results? Huge cost efficiency. When they let go of the people that had not been running the practice the way that they had hoped or expected, relative to physicians' first fees, they saw a 50% cost reduction within a month. Revenue was up over 20% per encounter on average, and that meant that physician revenue was up and overhead revenue was up the same amount, about 20% within 2 cycles. And probably the most important thing was doctor satisfaction and practice time growth. 100% of the physicians in the practice gave both Physicians First and that clinic a huge amount of praise. Most of them have started to take more time. 2 of them have referred friends and colleagues. And as a result of that, the quantum of encounters is actually up now well north of the 20%, actually close to 40 to 50%. And this is, again, within just 4 or 5 months. So why did this approach work? And what's really important for us to remember as we think about other practices that are out there, whether they're turning around or growing? 1, culture of accountability. Accountability is key. In any industry, in any business, if you're working with people, open eyes and clear reporting means people must do what it is that they say, and they will do what they say because they know that everyone else can see. Social accountability is critical. The second one, improved KPI tracking, making sure that improved patient care, outcome measurement tools, and all of the other components that go into building an effective practice and a meaningful practice, and not just a profitable practice and not just a factory. It means that the physicians and the clinical team can feel really good knowing that they're doing better care and doing it in a more effective and potentially more efficient way, which helps the practice to grow so that it can ultimately hire more people to help more patients. Of course, it also helps with enhancing team alignment. When the team is aligned, when the vision, the mission, the values of the practice are all there, and you're measuring against what it is that you're looking to do, you're either on the team or you're self-selecting yourself out. And that team alignment makes such a huge difference. And then, of course, the last and most important component Revenue reporting and cash flow optimization fast really helps with all of those things. When management or leadership do what they say, and the result is money in the bank, more money coming in, more money in people's hands, everyone feels better and they can get more aligned because they see quick wins. So that's it. Let's do this together. We're here. We've seen a lot. We've done a lot. We're always happy to listen and help. And if there's anything that you'd ever like to talk about, just feel free to give us a call. Take care.